that there's a long history to the discussion that our field has had about countertransference. So historically, traditional analysts thought of countertransference as a bad thing. Therapists were not supposed to feel anything about their patients. They were supposed to be neutral and detached. A well-analyzed therapist wouldn't respond to their patients with any kind of emotion. They would remain neutral and professional. That is what we call the classic position on countertransference. I can tell you it's probably a view held by a minority of therapists and analysts today. I think most practitioners have moved beyond that notion that if you feel something while you're working with your patients, you probably need to go back into therapy. I don't believe that. I'll tell you my bias right away. But I also don't think that's the view held in most circles today, even among training analysts. So, more modern view is a more liberal one, where countertransference is viewed as inevitable. It is seen as coming from two basic sources. One is the feelings that a therapist can have when they're working with a patient can come from that therapist's own experience, right? So the patient reminds us of someone from our past or present, or the patient engages with us in a way that is similar to someone from our past or present, and it stirs up feelings that really have at the root of their source are the therapist's own issues. Okay, so that can be a piece to any countertransference reaction. But I think a more modern view on countertransference also is open to the idea that there are certain feelings stimulated in a therapist that aren't unique to him or her, that the patient would stimulate in any therapist. Okay, so when we think about any reaction that we're having to a patient, we have to first be open to that reaction that we're having and be reflective on that and acknowledge what we're feeling in the moment with that patient, but then also be able to reflect on, well, what's stirring this up in me? Is this my stuff? Does this have to do with my past, with maybe present conflicts that I'm struggling with, whatever it might be? Or is this, am I having a reaction that probably most people would have to this patient in taking into consideration how the patient is presenting, what the content of their presentation is, but also the sort of process of the treatment. So two sources in today's more modern or liberal view of countertransference. So if we have this idea that therapists have countertransference, what kind of research has been done on that? Here's a study by Batana et al. That factor analyzed countertransference reactions. So they went out and talked to a whole large group of therapists and asked them, what are some of the reactions you have with your patients? They took all that data and they factor analyzed it. I won't go into factor analysis because I'm assuming most of us took statistics and have long since forgotten factor analysis. But in any case, they subjected that data to factor analysis and came up with 6 factors that therapists report experiencing when they're with their patients. 1, overwhelmed, disorganized. So the patient is confusing, disorganizing, overwhelming us. Helpless, this feeling of I don't know what to do with this patient. Inadequate, where the therapist actually starts to feel like, maybe I'm just not firing on all cylinders. Maybe I'm not that good of a therapist for this patient. Feeling special or over-involved with the patient. Sexualized and criticized, mistreated. These are the 6 factor analyzed responses that therapists report in reaction to their patients. Now, countertransference, and that data came from studies looking at therapists working with all kinds of patients. when you think about countertransference and personality disorders, I'll present a rationale here for why I think it's a much more important thing to be mindful of. The rationale here is that personality disorders, if you look at the definition, the DSM definition of what a personality disorder is, it's defined by maladaptive interpersonal functioning. Okay? That's what all of the personality disorders are defined by, that these are individuals whose interpersonal behavior, whose behavior in relation to other human beings is maladaptive in some way, right? So since that's the case, and since countertransference is mostly an interpersonal phenomenon, I think it's logical to expect that therapists are going to report stronger countertransference reactions to personality disorder patients, right? In addition to that, we're going to talk today about projective identification, and personality disorder patients' use of that is much higher than other diagnostic groups. And so we're going to talk a little bit about what impact that has. Now, those of you who are not psychodynamically inclined, don't worry, that's okay. This is the most complex topic that we'll get to all day today.